So on to our presenter today. Megan Wood is a Senior Research Fellow at the Bradford Institute for Health Research, and she specialises in child and adolescent development. Megan has been affiliated with the Born in Bradford cohort study for over 10 years, contributing to longitudinal research that uses administrative, linked and cohort data to explore health, well-being and social outcomes to help inform policy initiatives. Megan has expertise in research design, quantitative data analysis, and translating complex findings into actionable recommendations. So we're really pleased to have her present today. Megan, I'll pass over to you now.
Thanks, Nicola. Hi, everyone. So yeah, as Nicola said, today I'm going to be talking about unlocking the power of routine data, and we'll take questions at the end. So yeah, keep them either in the chat or in your head, and we'll come to them at the end. So just as a quick overview, this is what I'm going to be covering today. So we're going to be talking about data and decision making. What do we actually mean by routine data, given a bit more of a definition? And we're talking about the benefits of using routine data in research, as well as some of the challenges that we may come up against. And they'll be going through a sort of step-by-step guide along with a worked example, just to sort of put it into practice and make it a little bit less abstract. And then I'll be talking about how we can create impact using routine data, and then we'll go on to the question and answers at the end. So just a bit of a heads up in what I won't be covering. So I won't be going through almost how to analyze or visualize your data, or how to actually share routine data or write up your findings. There's some excellent alternative webinars that I think cover these sort of topics through the NIHR RSS, so that's not what I'll be covering today. So more and more we hear both local and national government talking about using data for decision making, and this is becoming really, really common, and this is definitely not a bad thing. And here are some of the buzzwords that you either might have come across or might have even used yourself. So things like evidence-based policymaking, evidence to action approach, data-informed insights. These are all sort of terms that are thrown around a little bit. That is becoming increasingly common, especially in, as I say, local, national government and decision-making arenas. But what do we actually mean by this, essentially? So it's about using data to properly understand need. It's about using evidence to target resources appropriately. And it's also about evaluating what works and what doesn't work, but also backed up by evidence that we have available to us. So does this mean that we need to collect more data? Do we need to be producing more surveys, running more focus groups, conducting randomized control trials, making dashboards? Is that what we're saying that we need to do? And the answer is not necessarily. So while that could be useful, it's not. We don't necessarily need to just produce more and more and more. And the challenge is often not through a lack of data, but it's making better use of the data that we already hold. And that is where routine data comes in. So routine data is sometimes called administrative data or routinely collected data. Those are other alternative names that you may be familiar with. And importantly, this is data that is not collected as part of this is data that is collected as part of everyday service delivery, and it's not collected with research purposes in mind. So some examples could be healthcare data, education records, crime, housing, social care, and the likes. And some of the benefits of routine data that we can just quickly go through is that, one, it's readily available. So we're not having to conduct the focus groups, produce new surveys and things like that. These are data that are already there just through normal service delivery. And this can be really helpful in terms of longitudinal analysis. So in terms of, we're not just getting potentially a snapshot in time, which may be the case if we were going out into the world and collecting our own data. We can actually get access to trends. We can think about when a new policy comes in and think about, okay, so what happened, what was going on before, or this was the time point that that this new policy came in. Okay, what's going on afterwards? And we can actually see that with our data. That may not be as easy to do if we didn't have that routine data available. It's often large and representative samples. So this is something that's particularly important if we are, for example, improving service delivery. We can often be at risk of biasing our samples if we go out to collect data. The people generally who want to want to take part in research may be white, more affluent, better educated, and this may not reflect who is actually interacting with our service. So by using data that is there and reflective of what's actually going on in the world, is going to make our outcomes more realistic and then allow us to make those better decisions later down the line. Equally, it reduces burden on participants as well. We're not asking participants to do another thing. We're not asking them to complete this 20-minute long survey. We're literally using data that is already there in their records, in their healthcare records, for example, in their social care records. So what kind of questions can we ask them with routine data? And a few examples from across different public service data sets. For example, we could look at how many children are entering social care each month. Is this changing over time because we have that longitudinal data? Are there geographic areas where service use is disproportionately high relative to population size? So we can use spatial analyses to sort of look at, okay, well, in this particular area in the district, then service use is extremely high, whereas actually in this area it's a little bit less so. So actually let's pump more resource into this where it's actually needed. How long do people wait between mental health referral and support? Are there schools or areas with disproportionately high exclusion rates? And can we identify early indicators of future persistent absence? So these are all potential questions. Obviously, there's so many more that we can ask using routinely collected data. So it's first, and which populations have the highest rates of emergency admissions for emergency for A&E services, for example. And first of all, it's worth asking, is it possible, the question that we have and the question that we want to answer, is it possible to explore this, at least initially, with routine data? We can conduct exploratory work, and then if we need to collect more data or ask those surveys or focus groups later down the line to complement that, then we can, but almost starting with what is available to us already. So in terms of challenges of routine data, one of the big things that comes through a lot is that it's incredibly messy. Or it may be messier than what you're used to. If you're collecting your own data, you're in complete control of how it's recorded, what is done with that, etc., etc. Whereas routine data, it was never intended for research purposes. And it's, as I said, it's just collected as part of daily operations. So it may not be as polished as you're used to, and it may require a lot of initial cleaning to get started. So examples of how this could be messy inconsistent coding, missing data, the big ones that generally come up with these kind of data. And this could be due to a number of different reasons, but it could be that almost how the data is supposed to be recorded is not what's actually reflected in real life. These could be very different, and it may take a little bit of detective work to figure out what's going on. All the data, all the information that you would ideally like to answer your question may not be available. So it may be that you can start to unpick what's going on, but you may need the experts or practitioners to fully understand the data and what you have there. Routine data tells us the what, but it doesn't always tell us the why. And that's again where that lived experience and context is really needed and really, really helpful. Routine data, especially if we're thinking about public service data, so for example, healthcare records, for example, can often be very sensitive, and it needs to be treated ethically and responsibly. So it takes time for potentially applications to be put through data access and things like that. So that's just something to keep in mind when working with routinely collected data. And then lastly, data are not always available in real time. This can vary from different organisations, different data sets, for example. It may be that there's an annual release of all the data from the previous year, for example. So this is just another thing to consider. But all that being said, imperfect data is better than no data at all. And sometimes it's the case that we can at least start to answer questions that we may not be able to even begin to answer if we didn't have these data available to us. So just going through a bit of a step-by-step guide. So these are not set in stone. This is not the definitive way of conducting research with routinely collected data. And it's definitely not linear. So that there may be a little bit of back and forth depending on what you find along the way and how your project develops over time. And this is especially the case with routine data where you don't necessarily always know what you're getting. You're not in complete control of the data available to you or the data quality. So you may have to adjust accordingly on the way. So first question is identify the problem. What is it that you want to find out in your work, in your project? What is the issue that you're identifying? So that's the problem, and then we need to think about, okay, so that's the problem. What is the question, the specific research question that we can ask to start to address that problem? Next, we need to define the population of interest. So what it's not always possible to look at everyone all at once. People are not a homogeneous group. So sometimes it's easier to think about a specific population that we may be interested in for now, that we can then build, we can scale, or we can compare populations later down the line. We can think about identifying our data sets, data set or data sets. So what information do we need and where might we find this? For example, is it the education records? Is it social care, for example? And once we've figured out the data set, the general data set that we made, find that information, we can think about and in terms of identifying your data set, there's generally two options available. So this could be publicly available data sets, or this could be your own organization's data sets. So public data sets generally tend to be either ready to download and analyze straight away, or they could also require submitting a data access application or expression of interest, for example. And here are some examples of some public data sets that you may use. So UK Data Service, And the Office for National Statistics, these are sort of their data catalogues that you can go away and look at, or ADR UK data catalogues. And this covers a wide range of different data available, such as economic activity to healthcare to even agriculture. So if there's something that you're looking at more generally, it could be that you a public data set may be appropriate for your project. Alternatively, you may be interested in specifically your organisation and your local authority, for example, and using your own organisation's data. So as an example, we could look at, if we're interested in children's social care within the Bradford region, we may just look at data from the Bradford Children and Families Trust that own that data, and they're the data controllers. So the next step is deciding your key measures or proxy measures. So what actually is it? What's the outcomes that you're specifically interested in looking at, and what data may be available within that data set? I say proxy measures because sometimes if you're interested in a particular outcome, you may not be able to get that directly, and you may almost have to have a bit of a workaround to just shine a light on what could be indicative, even if it's not exactly what you would originally wanted to measure. Next step is gaining necessary approvals. As I've touched upon, this could be expressions of interest, it could be data access, it could be it depends massively on what data it is that you're trying to retrieve, depending on how sensitive that is, for example. But it's something to bear in mind that it can be a potentially lengthy process if you need ethical approval and things like that. Cleaning your data, again, I have already touched on this a little bit, but this is probably one of the biggest parts of your entire research project. It's getting to grips with your data, it's cleaning it, it's working out, is this right? Is this as it should be? Is this what I was expecting? Are there things that I need to put into place to make it appropriate for what I want to do with my analyses? And then we can do the fun bit, which is exploring patterns and analysing your data, which is a bit that people think is the longest part of time in your research project, but actually this is takes a considerably less time than potentially cleaning your data in the previous step. And just a few hints and tips in terms of analysing your data, especially when we're using routinely collected data. This is just sort of standard practice, but document everything, anything that you do to change your data set, making new variables, in terms of cleaning your data, make a note of that, because then that's something that someone else can return to, or it may be that could be used in the future by your organisation. Keep analyses simple. A lot of the time, simple is better. We can answer some really interesting questions that may not have even been looked at before, often by looking at counts and means and things like that. We don't necessarily need to do this cross-lag model to find something interesting out and something that's usable. Consider potential confounders. Again, people are not homogenous. Think about what could be impacting any relationships that you're interested in looking at and control for them appropriately, or include proxy measures. And don't disregard non-significant findings. This could occur for several different reasons. It could be that your study is underpowered, for example, you need more data. Or also it could be that that's just the way it is, and that is telling you something, that if there isn't an association, that's still important, and that's something that still should be considered and looked into further. And then we've done all our analysis, we've explored the patterns, we can start to translate that into actionable insights. Okay, so what are we going to do with this information that we've created? How can we use it to improve our services or make a real change for the world? So that's where that's where we can actually use that into that sort of that data-driven decision making, for example. And then we can conduct further scoping or further research if necessary. It may not always be necessary, but this is sometimes where the focus groups or the surveys may come in handy to just gain that context and that nuance that we started to unpick with the quantitative analysis of the routine data. So just as a bit of a worked example, I won't go into this too much because I realise it is quite a long list. But just to sort of give a bit of context and a bit of an example here, your problem could be that absence rates in our district are too high. Something needs to be done. So in terms of our specific research question, we want to know which pupils are at risk of persistent absence. So in order to do this, our population of interest is going to be secondary school pupils. These are the ones that we've found that are the absence rates are maybe particularly high, and we're interested in pupils within my local authority specifically. So what data sets might we need? Okay, so we're going to need education records, and this is going to be the attendance records and maybe the school census as well to get a better idea of the context of the school environment as well to just put it into context a bit better. Our key measures or proxy measures. So we're going to need to look at persistent absence rates. We may also want to look at gender, special educational needs status, ethnicity, free school meal status, etc. To again account for any confounds appropriately. We need to get the appropriate data sharing agreements and ethical approval. Cleaning our data, we may want to remove duplicates, standardized date formats. That's a really common one that can cause a bit of a headache or omit implausible values. So, for example, which links into the date formats, it's quite common in routinely collected data for an NA value or a missing value for a date to be like the 1st of January 1800, which of course we don't have data for going back that long, but that's just something to bear in mind. Things like that and quirks like that you will pick up as you go through and you're getting to grips with what your data look like. And then we can explore patterns and start to analyze our data so we can compare absence rates across groups. Okay, so gender, ethnicity, SEND status. We may want to conduct regression models and to look at associations and things like that. Translate into actionable insights. So, okay, so we found that white British boys are at greatest risk of being persistently absent from school. What interventions are needed for re-engaging that particular population back into school and reducing that risk of persistent absence? And we can conduct further work, so working with parents, teachers, and the young people themselves to better understand the why. So why might it be that this particular group has high absence rates? So in terms of making an impact with administrative data and routine data, this is just an example where this is a piece of work that I've conducted a couple of years ago, and we were interested. There is a particular reason that I've used absence as my example, as this is something that we did exactly that. And we looked at the absence rates and school readiness assessments, and this was both taken from education records from Bradford Local Authority. We included data from over 60,000 pupils across Bradford. Again, this is something that we wouldn't necessarily be able to do if we were going out and asking 60,000 pupils what's their absence like, what's their school readiness, etc. It's just not feasible to do at that scale, whereas the data are already there. We can use it using routinely collected data. It also meant that we could look over time. So, for example, for those who don't know, school readiness is something that is conducted when pupils start reception. So, when they're 4 to 5 years of age in England. And so we have that data from that time point, and then we have their absence rates going across all the way into secondary school. So we've got that real trajectory of how their absence changes over time. And okay, if they're not school ready at 4 to 5 years old, what does that mean for their attendance rates when they're in year 8, for example? And what we found was that pupils who were not school ready had increased odds of becoming persistently absent at some point later in their academic career. And so often in academia, we do these kind of works. We have the paper that goes into the journal. But this was a really interesting piece of work, as we really made a point of, we want to do something with this. We want it to inform policy. We want to make a change. And this is just some of the impact that we had off the back of that work. So we had a policy briefing note that went out and received a lot of traction, which led to a piece in the Yorkshire Post, which is at the bottom right, where I was invited to talk about how we were using routine data to address the absence crisis. In the middle, we were, myself and my colleague Lydia Gunning were invited to speak at Evidence Week in Parliament last January. So again, we were engaging with policymakers, letting them know, okay, this is the data that we have available. This is how we can use it. This is how it can make a real change. And then some of this was featured in the Child of the North report on improving school attendance across the country. So to summarise, I've kind of gone through what is routinely collected data. Hopefully I've achieved all those outcomes that I set out at the beginning. But local and national governments are increasingly relying on data to inform decision making, and routine data already exist within everyday service delivery systems, and we can use routine data to avoid that time and resource expensive data collection. That often means that we can't conduct certain research studies, or we can't answer certain research questions because of time or funding limitations. But routine data lets us have large samples. It avoids that participant burden, and it can really get us some really impactful insights for policy change and making the world a better place, hopefully. So thank you very much for your attention. And yeah, I'm happy to take any questions.
So see, there's a hand, or I'm not sure if that was a hand raised or a clap, but there's a couple of questions have come into the chat, Megan.
Yep.
So while people are having a think, it might be a good place to start. So I'll read the first question out. Is ethical clearance needed even for your organization's routinely collected data, provided all administrative approvals, permissions were obtained and data are sufficiently anonymized?
So I think that that's a really good question, but I think that just vary from organisation to organisation. Sorry, let me just read the question again. Yeah, I'm sorry, this is a really rubbish response, but it depends. It depends exactly what it is that you're interested in looking at, and the your own organisation's sort of protocol there. So it's something to definitely ask the question. It may be that you can almost just do an expression of interest in a data access form, or it could, depending on what it is, it could be that you need a full ethics approval.
And then you probably see there's another question in the chat there from Nafis. So just asking for any advice around ways to know what kinds of data are available. Is there maybe a way of formulating a list so that somebody like Nafis, who's a LARP in a local authority, is able to see what research priorities can be answered through that list? And if yes, can you point our audience towards a way of doing it, making it maybe a bit easier and sort of more, clearer for everybody?
Yeah, of course. So it's definitely not a silly question. So if you're interested, so there's the sort of national data sets that I shared at the beginning, sort of in the middle, which were things like the Office for National Statistics, or the UK Data Service. So they have like full data catalogues, which are really helpful to sort of see what is available. However, if you're a LARP and maybe interested in only looking at what's available in your local authority, I guess that's almost down to your local authority to make that information available. So it may be that you need to talk to the service providers and see what kinds of things they have available, because it may be that they haven't actually got that nice clean data catalog. This is something that's I think we're trying to work on, and things like Connected Bradford or Connected West Yorkshire is starting to make that easier and create this sort of platform. But yeah, I think it's still a work in progress through that. But I'm happy to share links if you're interested in the national data sets, like the Office for National Statistics and the census and things like that, where you can look at the data catalogues.
I think that would be great, Megan. That would be a good starting point for people, wouldn't it, to know sort of nationally what's collected, and then I guess focus in sort of locally and work out.
And then you can ask the questions, if you know what's there.
Brilliant. So Hannah's put in a question: when using a newly available data set, what are the first tasks or main principles you should be starting with when you're opening up the data set? E.g., what will you appreciate having done at the start when you are further on in the project?
Great question. So I think, firstly, making sure you have that time almost factored in. There'll always be stuff that sort of pops up or takes you by surprise. So really just almost looking at your data. So you could I appreciate one of the benefits is that it's so big, but also that can be a bit challenging when sort of working through. But you can do things like summarizing, looking at almost your largest and smallest values, and just sort of general data cleaning principles, I guess. So there's a lot of guidance online if you look through, if you sort of Google standard data cleaning, and you may be able to find stuff that's specific for routine data as well. But it's things like your implausible values, how much of your data is missing, is there something, for example, we've got this massive block missing, and we don't have any data for this time period. Oh, that was from COVID. They didn't do any reporting during that period. So sort of things like that, and sort of just getting a bit more of an understanding of your data will be really helpful. And in terms of almost working for future you, as you go through the project, documenting everything. So any quirks that you find or anything that you have to change, making a note of that is going to be really, really helpful for you in the future, and also for anyone else who comes to look at these similar data later down the line.
The question from Catherine: is consent required at the point of collection in order to potentially use the data for research purposes in the future?
So again, this is a really rubbish answer, but it does depend again. So things like GP data, for example, you consent to the sharing of those data when you sign up for your new GP practice, for example, and it's like I consent to my data being shared. Those kinds of clauses that most people just tick tick tick. Yes, I'm happy. So a lot of the time, those consents have already been sort of made prior to any data coming your way. So the consent is normally fine. It's just like later you will need that approval from your data protection officer or things like that. So I hope that answers your question.
And this is linked again. All the questions have sort of had a link with each other. So Kate is asking, as commissioners, we will often analyse data for service planning and improvement purposes. If that also proves to be worth publishing, is it then that the ethical approval issue arises from the journal concerned? Is it as simple as seeking ethical approval to publish findings? This has become a considerable barrier to publication and limits sharing learning.
Yeah, 100%. And this is where it gets a bit tricky, and something that we've even faced in the past. So, for example, many journals will say, in terms of wanting to be open and conduct open science, which is a great thing, it's not always possible because these data are very sensitive and we literally cannot share people's GP records to be made publicly available. That being said, there are ways around it, and so for example, the paper that I shared that we use routine data from pupils' education records, we did put a clause when we submitted to the Royal Society saying like we cannot make these data available. So it may be that you need to find an appropriate journal who is a bit more flexible, and make a real case that actually what you found should be published, and is going to actually provide a real benefit over the data being accessible to other people, and it's just explain why. But that can be a real tricky thing, and hopefully that's something that does improve with time as routine data become more and more popular.
Yeah, and another question again, and absolutely it acknowledges the confusion, or maybe the difference from local authority to local authority, and the difference in the reason for collecting the data and what you're doing with it, and that kind of thing. But Lachlan's asking for any guidance or a policy document on ethics for routinely collected data. And I guess in terms of where that responsibility lies and that kind of thing, I don't know if there's a clear answer to this either. I know the specialist centre is something that we're working on.
Yeah, I'm not aware of any sort of set in stone guidance because I think it, as I say, it does vary so much from organisation to organisation. But it's potentially worth at least asking the question to, for example, your data protection officer, if this is something that actually can be produced, to make it easier for people to use those data. I come from, I'm a little bit biased in that I come from Bradford and work very closely with Bradford Local Authority, who have created a real infrastructure for this kind of work. And I appreciate that some other local authorities are still potentially catching up. So what I've done may not quite always be possible yet, but it's definitely worth asking those questions. And if that's the thing that individuals are interested in, it's definitely worth asking if these sort of things can be put into place so we can actually start using the data that are available to us. Yeah, because if no one asks for it, I guess there's no reason for them to do it. Whereas if there's a bit more of a demand and you can almost say, well, we're going to do it for X, Y, Z reason, that may be a way forward.
And we recognise, and one of the reasons that we asked Megan to speak today, as well as being one of our methodologists, that connection with all of the work that Bradford has done. We know that you're a trailblazer in that space, and so there's examples that people can take from the work that's gone on there, and that's what we've tried to do in terms of producing this webinar, and also learning stories that we're working on. just to really showcase those examples and illustrate different ways that people have gone about it, to give some ideas. And we realise that every local authority isn't going to necessarily uniformly adopt the same approach. But it's really just sort of ways of sparking a thought process to think, okay, could we do something similar, or could we, longer term work towards something like this? You very much, you've got many more years ahead of a lot of local authorities that are looking at using data in different ways, and really it is just sort of allowing people to sort of see how people have gone about it, what sort of examples there are, what's worked. And then being able to take that and make it, the right for your local authority and your right environment. It's got to have that sort of backing of your data protection officer and all of those kinds of things as well. We recognise this isn't something that one individual can necessarily set out. It takes the collective, and the local authority have got to be behind it.
Yeah, definitely. It's worth saying as well, like that I think this will be becoming this is increasingly popular. I think it's really gaining momentum in terms of using these data in this way. So we have things like the secure data environments that are coming up and sorry, that are getting there. So we've used sort of Connected Bradford as so for those who don't know, Connected Bradford is a platform that we have all this routinely collected data that is linked. But that, as Nicola said, that's kind of been a bit of a trailblazer for, okay, now how do we scale that? So we've kind of been the guinea pigs in Bradford, but hopefully that will become a little bit more of the norm. So yeah, this is a lot inspiration, I guess, for what can be done, hopefully. But yeah, I appreciate that it may not all be possible in your particular area right now, but hopefully soon these kinds of questions can be answered.
Yeah, I've just shared the learning story that we created for the Connected Bradford data linkage as well, because that was an example that we wrote up. So we've got a couple of learning stories around data and managing and sharing data for people to be able to look at. But really happy to have the conversations, and Ellie, who leads on research governance and ethics, is doing a lot of work in this space as well, because we recognise that there's a lot of people testing and learning and having conversations, working out what suits their environment. And it's sometimes helpful to just see what else other people are doing, and as I say, have access to those examples so you can share them with others as well. So those learning stories are written as just really easy read, 1 or 2 pages that you can share with other members of staff, elected members, anybody like that. You don't need to be a data scientist to understand what is written on there, is what I'm saying. So that was a little plug for our learning stories there. So any further questions? Does anybody want to raise a hand and ask a question directly to Megan, or anything else to go in the chat? Some lovely comments coming in. Oh, that's excellent. Great. Can't see any further questions. So just to say thank you so much, Megan. Really informative. We know it's a complicated space, so thank you for making a bit more sense of it. Thank you for the webinar today, and for everybody's attendance and all of your comments and questions.
Thank you, everyone. Bye.